So Sarah, we hear you. Are you talking yet?
So it's a great opportunity to actually give a voice to the nurses who are living the reality of dealing with this pandemic. So we launched a study that was aimed at better understanding the experiences of critical care registered nurses that were providing direct patient care during the early phases of the pandemic. Our study was designed as a convergent mixed method study. So we used validated surveys as well as semi-structured interviews that have been used in other pandemic, particularly some of the early information that came out of China, and also previous pandemics such as the SARS or the MERS pandemic. So we used the impact of event scale, which engaged in one-on-one semi-structured interviews with myself. All the interviews were recorded and then transcribed for analysis. All nurses who worked in both the ICU and also the high acuity were invited to participate. So what we did, were exhibiting significant symptoms of post-traumatic stress. They were also experiencing significant amounts of anxiety and stress. I did do further analysis looking at symptoms, and there wasn't one group that was at higher levels than others. So everybody across the board was experiencing a tremendous amount of interviews, provided more day-to-day of their story. I think it really brings to light the lived experience. It also provides a narrative that we're hoping to share far and wide so that the public can better understand what it was like for the frontline workers having searched psychological distress. The main from the data showed that the symptoms were all related to rapidly changing policy and information, overwhelming and yet unclear communication. A few key quotes that came out of the research. They were so powerful in talking with the individuals that were willing to share. So we looked at changing their minds, and there was like 1 million emails about what we should do and shouldn't be doing. I'm so busy caring for my patient, I don't have time to read that stuff you're sending. I'm sure it's super important, but I don't have time to read all that, and it's super annoying that you feel I'm supposed to listen to. There was too much information coming out, but not the right information, what we needed or wanted. It was so distressing to hear the stories of people being afraid to go into the updates that our staff are living with. Looking at overwhelming and unclear communication, another one of our participants stated, I would also like to see clearer communication. There were so many of you that it was who didn't. It would be nice so you wouldn't be worried as you're caring for a patient with COVID that there's a new email waiting with some important piece of information that you had no time to read. Trying to meet patient care and caring for patients because of the many panicked moments of, am I protected enough with the PPE I'm using? And the most frustrating things was donning and doffing. That's how we organized our day by trying to ensure everything was on correctly. And the half-mask respirator were really uncomfortable to wear, especially for long periods of time. Maintaining home and personal commitment that came through our anxiety. One, I was afraid of working on the front line would put my family at risk, and I didn't want to come to work. Another stated, I was worried about a person and feeling guilt. Her interactions with the community and how she close, and her response of like, I'm trying to walk my dog, I'm not contaminated right now. We heard similar things about going grocery shopping in public, but also having to deal with the stigma outside of it was really adding to the anxiety and stress that people were feeling. So I know this isn't new to anyone who's listening, but all your staff are feeling these things. Through formalized research, and this is also pending publication. I'm just waiting to hear back from the journals for the manuscript. But we've been able to acknowledge the stress of our teams. We've been able to share these results with senior leadership to improve the processes and prepare for the second one. We've seen next steps coming out. We've seen a more streamlined process of communication being developed. I think it's still being rolled out, so I don't know how effective it's going to be, but able to help offer our staff. So we've had the EFAP program, the employee support program. We've also had a psychiatrist who's been doing resilience building huddles on our unit and is offered to do small group sessions as well, engage with it. I've got my email for questions and comments, but I want to share, I think, a really great quote, and one I've heard a lot from different leaders now. And I think as we move forward with this, we need to acknowledge to one another that we're doing the best we can, and this is all the way from the top down to us at the front line, and more information coming around each other, supporting one another, and there seems to be, at least from my perspective as a nurse practitioner on the unit, there seems to be more of a sense of calm, a more structured approach. The anxiety doesn't seem to be as high, but I still think as we move forward and kind of wait to see what happens next, that we need to continue to be mindful of the impact it's having on us. I think we need to be kind to each other, take care of one another, not be afraid to accept the help when it's offered. I think we all do a tremendous amount of work and sometimes are trying to do it all and remembering that we don't have to, and just remembering to voice your experience and to make sure that you're being heard and that there's channels for that. So I just thank you for letting me share that research, and I'm looking forward to seeing what more becomes of this, and I'm hoping to do some more work with our unit, and I know there's other groups across Canada too that are looking to do similar studies like what we've done to measure the impact on our group as the pandemic unfolds further.
That was fantastic, Sarah. Thank you so much for running through all of that with us. And it sounds like a tremendous amount of work, but definitely really valuable. A couple things that came through for me was when you said that some people had suggested a set time and date for information to come out. And that was one thing that we found in our survey at KGH as well, like that would provide them with a bit of a sense of certainty. Like they know that they can expect every Tuesday and Thursday, for example, at 3 o'clock, there's going to be new information. And so that would cue them to go there rather than to look for it, rather than having like all of these emails randomly sent out that they need to try and get to as they're providing care for patients. And so I thought that was really interesting that that was brought up for you guys as well. And one other thing that was similar in our surveys is that nurses were really afraid, or staff really afraid of taking COVID-19 home to their families. And we asked them a whole list of things that we were concerned about, and that was even more of a concern for them than getting COVID themselves, was bringing it home to their families. And also the stigma, we had a lot of comments about that too. And then the resilience building during huddles, I'm interested in that. That was something an outside psychiatrist did with you guys?
Yeah, our site quality improvement medical director is actually a psychiatrist. So she's done resilience building sessions. So really trying to help staff focus in on what they're experiencing, helping to acknowledge some of the struggles they're having. A great is the lack of visitors, and how some people are really struggling, especially with patients dying without visitors. And so really helping them to understand that they have conflicting thoughts about it. So we have this family-centered, patient-centered care that they want to be able to give, and yet we now have a lockdown unit with no visitation, and just really helping them to understand that it's okay not to be able to meet both of those needs, and that given the situation, acknowledging the fact that they want to be able to do this but can't, and it's of no fault of their own, has been really helpful. So similar things like that, just being able to acknowledge what they're struggling with, and that it's okay, everybody is struggling, and how do we turn that into a positive thing, and how do we continue to build ourselves up. I know I've heard her encourage people to take days off. There's been so many people who are so dedicated to the teams and don't want their teams working short, especially when they know that they're bringing in non-critical care staff to help. So there seems to be this sense of ownership that I have to be there for my team, and hearing her say that it's okay to take a break. You know, some people just that peace of mind of, you know, I want to help today, but I can't. That's okay. So I think that just that resilience building and validating some of the thoughts and feelings and experiences have been really helpful. And then in the small sessions, people were able to sign up with 10 or 15 colleagues and do a private session where she would do more in-depth resilience building. And then if people were really struggling, she would direct them to professional avenues to further support them, just to make sure that the teams were getting what they needed.
That's fantastic, Sarah. Thanks for sharing. That'll definitely be something that we sort of take forward for KGH and interior health leadership to consider. So thanks for sharing.
You're welcome.
Yeah. And does anybody else have anything they'd like to say before we close?
Just one thing. I want to recognize that thank you guys for putting this together. It's been really an amazing thing to put right in the beginning of our second wave of COVID. The work that you guys have done is volunteer work for the CACCN. So if you want to support this work, please do consider joining the CACCN. It's a great crew, and I just loved being a part of it for the years that I've been here. And second thing, the National is having their AGM on September 30th. So please do join, because we really want to be responsive to our critical care nursing community.
Sounds good. Thanks very much, Vinny.
Thanks for watching, everyone, and thank you for joining us on the BC chapter of the CACCN YouTube channel. We have a lot of great content from previous events we've had over the past 12 months. I would suggest subscribe and hit the notification button so you can know when the next thing is out. And if you ever want to come to our next event, we're on Facebook and on Instagram. Our links are listed below. And while I'm on the topic, if you're a critical care nurse anywhere in Canada, why don't you join CACCN? We have a ton of resources to help you be the best critical care nurse you can be. Go to caccn.ca and join us.